right, here we are. Thanks so much, everybody. Really excited to see everybody here today. I'm so excited to be with our amazing community and just feeling really grateful for all of the advocates who we'll be hearing from today. One of the things that makes T1 International so unique in advocacy is that we are a global network of people in countries, as Liz mentioned, with an incredible variety of approaches to healthcare, support for diabetes education, resources for patients, and so much more. So even in the United States, where I'm based, there are so many differences between how states handle healthcare and what people can access to be happy and healthy. We all come to advocacy for different reasons, but we're united in our purpose to improve the lives of people with diabetes. And so I'm just really excited to be here today with our advocates. We have Arina, Sarah, and Ya are here. Thank you so much for being here today to share a bit more about yourselves, what you brought to advocacy, what brings you to advocacy, and what keeps you going. As a reminder, you each have about 6 minutes, and then we'll have a Q&A with the whole group after your presentation. So Arina, I'd love to start with you today.
Hello, everyone. Hello, Allison. I'm truly honored to be one of the speakers at Insulin for All Summit this year, and thank you very much for having me. Next slide, please. I'm going to talk about myself. I'm a digital advocate. And I was born and raised in Kamyansk-Saharsky, which is 945 kilometers from Moscow to the south. At the age of 17, I entered the Moscow State University and was really proud to be one of the students of the Moscow State University. In 5 years' time, I graduated from the university, and after my graduation, I was employed mostly in sports industry. First, I was working for the Russian Cycling Federation for 8 years, and then switched to Speed Skating and Short Track Federation or Russian Skating Union. I have many hobbies, and they are listed on the slide, and I simply feel that receiving new knowledge makes me evolve in the most positive and possible way. Next slide, please. So this is a photo of me at the age of 6 without a milk tooth, and nothing has changed. Pretty much nothing has changed since then, except for my teeth. So next slide, please. I'm going to talk about the period from November 1997 to November 2016. I was diagnosed in November 1997, and I remember the weirdest thing. I was told by my doctors then that I'm only able to eat 1 teaspoon of ice cream a year. And on the contrary, I remember the wisest thing. I was told by my parents that diabetes was slightly different lifestyle, but not a disease. So they've been my huge support all my life. They taught me how to inject, and from giving knowledge about diabetes to buying diabetes supplies and uploading some diabetes apps. They taught me how to analyze my body and my health condition on the whole, and manage my diabetes in the most professional way, so to say, if I can say so. And there is one more thing. Diabetes Connect is this is a project, a website and Instagram account, and it is supposed to be the most informational resource for type 1 diabetics in Russia. And I met the founders of this project in 2016 on the World Diabetes Day, and I simply wanted these people, the most caring and most caring professionals, to become my role model. So they did. Next slide, please. So you can see my parents. I call my biggest support then. And next slide. So my parents now. So for the quality, but it doesn't matter. And next slide, please. I'm going to talk about diabetes-related issues which troubled me a lot through years and which triggered the urge for advocacy. So I've often faced limited access to diabetes supplies, even though I'm fully entitled to diabetes supplies and free insulin, and I can get it every month, and it's fully subsidized by the government. Still, it's been a continuous fight of me with doctors at in my local polyclinic, and sometimes I send claims, something may change for a moment and then it's back. So it's always a waste of time and energy. And I have one supportive endocrinologist who simply gives me prescriptions, but is completely indifferent to other patients' needs and never tries to help others. All these troubles, along with some career and personal issues, may lead to diabetes, burnout, and I consider myself a lucky person who can deal with it without the help of a therapist. But I know that for many type 1 diabetics, it can be a heavy burden, and I would love to help people in this field as well. Next slide, please. So I remember September last year ago, exactly 1 year ago, I was surfing the internet trying to find an international diabetes organization to volunteer for. And I can admit that with T1 International, it was a love at first sight. I remember I sent my email, got a prompt reply back, then met a T1 International team on Zoom, and I became a digital advocate. In October 2021, I chose Instagram as a platform to share my knowledge and story with other diabetics and people who support us. So I also recorded 2 guided meditations for diabetics available in English and in Russian, and uploaded that on website. And I keep helping people who reach out to me for diabetes advice or recommendation offline. Next slide, please. It shows me in action, me advocating. And next slide, please. And so it's the last slide. What is next? Actually, a year ago in December, I had a good idea to launch a non-governmental organization to help type 1 adult diabetics in my local community to get all this official supplies on time and for free. But that terrible events that began in February this year in Ukraine made me lost for a long period of time. I even stopped advocating for some time, but then thanks to T1 International team and my family and my friends, I decided to change my path, and I've been working on creating a service which will deliver psychological support for type 1 diabetics. And even if I relocate, it's going to be a kind of my remote job in the future. So to be continued, thank you very much for your attention, and I'm open to your questions.
Good morning, everyone. Thank you, Arina. That was a lovely, lovely presentation. Just like to say thank you for this opportunity. It is definitely an honor. So I'm just going to take some time to just a few minutes to share why I advocate. Next slide, please. So these folks that you see in this picture here, the picture to the left, this is my boyfriend, Jeremy. Why I advocate for people who are in relationships that live, who are living with someone that has type 1 diabetes or any form of diabetes. When we first started dating, he had no clue what, other than diabetes is in sugar. So he wasn't really very well educated, on diabetes. So I just appreciate him taking the time to just learn and just be like a pillar for me, the highs and the lows and everything. On the right here, you'll see my dad and my younger sister and my nephew. I forgot to say, I was diagnosed with type 1 diabetes at 5 years old. So I've been living with it for the last 22 years. My sister, she was also diagnosed when she was about 7 or 8. And it has definitely been a journey. It has been a journey. Next slide, please. So the picture on the left is really what started my fire for advocating. My sister and I were sharing insulin from the same vial at one time, and this led to her being hospitalized for 4 days. As you see here, she had a PICC line in her neck. She just went through a lot, and I felt like it was my fault. I was working 2 jobs at this time, and was still not able to afford my insulin. And she was able to, she was on a different type of prescription program, so she shared her insulin with me. And I was just so angry at the fact that I had to watch my sister fight for her life due to me not being able to afford my own insulin. On the right is my mom and also my nephew and my brother. It's just, like I said, it's definitely been a journey, and my mom having to take care of my sister and I, and then also my brother. Like, my brother had to see us in and out of the hospital. He had needs too as a child, so it's just like, I don't know how he did it, but he did it, without any malice, because he didn't always get a lot of attention and stuff. So because one of us was always sick. So he's also been like a huge, huge, huge support, whether it's diabetes advocacy. I do social justice work. Also, like, he's always said, like, if I was to run for anything, he would be my campaign manager. So just having him in our lives has just been like, he's always been like comedic relief to all the madness. And my mom, I'm really conflicted on like speaking on her strength, because I don't want that to be confused with the narrative of like Black women being strong. But she was placed in a position where she just did not have a choice but be. So just if I was to be like half of the woman, half of the mother, like her, I would just be truly honored, because just to see her go through the things that she went through and the sacrifices that she made, that's another reason why I advocate, like, nobody should have to choose between a car note and their kid's insulin. And when people say that that's their life, like, I can relate to that. So just her being the backbone to everything, and making sure, like, not just, oh, we have our insulin, but we have to eat right, we have, clothes, just general things on top of managing our diabetes, even in our adult lives. It's just another push to why to use my voice. So next slide, please. I advocate for people that look like me, people that are not always in the majority. I advocate for people who don't always have access. Fannie Lou Hamer has this quote here: nobody's free until everybody's free. And that is freedom in my world, meaning, like I said, you don't have to choose between living in your car or getting your prescription, or even having, good education for your children, clean water, those types of things. And in relation to diabetes, nobody's free until everyone has access to their life-sustaining, their medicine, their supplies, anything that they need to keep them alive. Next slide, please. So through this diabetes advocacy journey, I have had some amazing opportunities. I have had the opportunity, I'm sorry, y'all, I forgot to send in a picture, because I got to meet President Joe Biden last December. But my advocacy journey would be nothing without T1 International. And I can honestly, earnestly, like, truly say that if I would have not met, crossed paths with certain people and had, come in contact with Liz and just the Insulin for All organization movement, there would be no advocacy journey, honestly. So I was able to participate on the first Community of Colors panel when the T1 International Summit came to Indianapolis a few years ago, I was able to, right here on the left is a picture of me at the Capitol. I was able to testify in front of Congress, the Committee on Oversight and Reform. And I've been able to meet some people that I know, like I can call when I need them through this advocacy journey. And there's just been so many opportunities that have been given to me that I'm just like, I feel like I'm forever indebted to T1 International for, because just the transparency, and then just knowing like this is not something that people can just, you can skip a dose and just be okay, so bringing the light to the global issue of access to insulin and diabetes supplies is just something that it's almost like, why would I not want to be a part of something like that? Next slide, please. So this picture here is of our last, I think this was the last time we met at the Indiana State House. This is some of the Indiana Insulin for All group here. And I believe we were talking about they got to pass a drug study pricing committee. So they looked into why the prescription drugs were too high, but they didn't really change anything. But we appreciate the effort, and for you, for them listening to our stories, living with type 1 diabetes and just other, autoimmune issues. It's expensive, and to be such a developed world or developed country, and people are dang near living on the streets just because they have to get their medicine or they're going without is just completely unfair. And so to be in the same, like I'm 20 minutes away from the Eli Lilly headquarters, yes, I'm going to take every opportunity and every chance I can get to tell the people who are tied in with this corporation and letting them know, yes, you have a lot of blood on your hands, and we're not going to stop until it's changed. I do believe that is the end of my slides, but I would just like to, again, close with saying thank you again for this opportunity. And I advocate for people that look like me, people that feel like they don't have a voice, and for people to know that they are not alone in what they're going through. Thank you.
Thank you so much, Sarah. I feel like so much of what you just shared, just appreciate you being so candid, and really so many things that resonate with, I'm sure, a lot of folks in the room today. So just really appreciate you being here, and are very inspired by your continued advocacy.
Thank you.
Next up, we'll have Ya. We'll hear from Ya. Thanks so much for being here too, and the floor is yours.
Hello. Thank you very much, Sarah and Arina. You were very inspiring. So I'm Bimpeh, and I've been living with type 1 diabetes for about 20 years now. I'm a nurse, and I volunteer for Diabetes Youth Care. It's a peer support group that provides education, diabetes education, and medical support to young people with type 1 diabetes in Ghana, of which, of course, T1 International is partners with. Next slide, please. So I want to start off by saying this quote from Anne-Marie Becker. She's a nurse and an attorney. She's also a politician. She says, "I'm passionate about people. I've spent my life in advocacy, and this is what is really interesting to me. People matter. Whether or not we agree on the issues, people matter. So therefore, if you don't agree with people that have challenges of life-threatening issues, you still know that they matter." Next slide, please. Whilst in Diabetes Youth Care, I have been learning about advocacy, but I really wasn't very active in it until I met this lovely young lady here. So this is Gladys, and that's me beside her. Gladys is a 17-year-old young lady. She was diagnosed with type 1 diabetes in the northern region. The northern region is one of the deprived regions in Ghana. So Gladys was diagnosed with type 1 diabetes and she was put on pills. She was brought to the western region. That's where I work. That was when I first met Gladys. She was brought to live with her uncle at the western region. So in the western region, Gladys had to travel about 45 kilometers to a clinic that provides diabetes access. And that was when I met her. She was really in a very bad state in DKA. So after attending to her and she's now better, she was actually seen by a general physician, first of all. She had no knowledge about what type 1 diabetes is. Her prescribed insulin and diabetes supply all had to be bought from out of the pocket. And that was what struck a chord on me. I mean, it triggered something in me. I knew how to do something. So I started my education sessions. I went through education with Gladys, and then I extended it to other hospitals and nearby institutions. Next slide, please. So this is why I continue to advocate. I always advocate until I see results, until I see changes. I will not stop until a person like Gladys has easy access to affordable healthcare, adequate diabetes supply, insulin, and has a somewhat easy diabetes life, because living with diabetes is difficult enough. This shouldn't stop her. Next slide, please. So why I joined T1 International, their vision really spoke to me. It says that we believe in a world where everyone with type 1 diabetes, no matter where they live, has everything they need to survive and achieve their dreams. I mean, it says a lot. So this was why I joined T1 International. Next slide, please. And I've gained a lot. These are just a few. Joining T1 International, I had a training on the advocacy toolkit, sorry. It equipped me to go about any advocacy plan I knew. It had country-specific training. It was personalized, so I could easily use it. And then T1 International with other NGOs formed an advocacy program group. It's called Pamojan Advocacy, which I was glad and happy or privileged to be part of. It was young African type 1 diabetics coming together and with the aim to increase awareness in the T1D communities across Africa, which of course I gained a lot. Next slide, please. So this is just a picture of me in the training with my fellow T1Ds. Next slide, please. This is also in one of my advocacy campaigns at a school. The school was about 600, they had about 600 students. And I believe that changing the view of diabetes in Ghana, not only in Ghana, in the world, has to begin with equipping the young generations with the right knowledge and information about diabetes. So you're starting small, but making a big impact across the board. Thank you very much.
Thank you so much for sharing. This is just a really amazing way to kick off today, hearing from all of you. I think we are holding for Kuda, who has not been able to join us yet. So we're going to go ahead and move us into some questions from everyone who's in the room now, and just really, really excited for this conversation. So if you would like to ask a question, you're welcome to put it into the chat. And also you can use the raise hand option. So at the bottom of your toolbar, there's a reactions button, and you can raise your hand there, and then we can also call on you that way. But if anybody has any questions for our panelists, we can go ahead and take those. And I can go ahead and just, as I'm listening to you all, I can kick it off and just ask quickly what, you've all mentioned that you had a lot of challenges as you're advocating, and just wondering what it is that keeps you going as you're advocating.
I'll jump in. I'll say what keeps me going is like when I go to community events and people are telling me their stories, and it just amazes me how uneducated people are about what's going on in their body, and it's not even really, it's not their fault. So for example, my cousin, she's type 2 diabetic, and she's been trying to get to an endocrinologist for like 3 years, and her sugars consistently run in the 300 and 400s, and she's unable to get like a prescription. They keep changing up her insulin, and so she's always sick. And then it's like, I met this lady the other day where she was like, oh, well, I'm about to go to Walmart or something. She was saying she was headed to the store, and she was like, but I don't feel too good. And so we checked her sugar. Her sugar was 400. And she was talking about going to Walmart to get some lemonade. Like, so it's just that's what I mean by access and knowledge, and making sure that people know what's going on and the possible damage they can be doing to themselves. But because you live in a certain area, or you live in a certain neighborhood, you don't have that access to quality health care. So that's what keeps me going, is being able to inform somebody and tell them, you should call your doctor and say this, and this, and you'll probably get some results. Because sometimes people don't know what to say either.
I think I can add, and I would agree with Sarah that there are so many people who lack the knowledge, and I've also met so many type 2 diabetics exactly, and there's always an urge to help them when I hear that they haven't taken the pills for several months, or etc. etc. So I really feel like the necessity to help them somehow, so they understand me. And also what makes me going on with my advocacy, I think those brilliant stories, articles of other fellow activists, T1 International, some digital advocates or global advocates, because I'm always inspired by those stories, successful stories of them. Or even if they fail, they still keep going to to their aim to change what they want to change. So this motivates me a lot, and doesn't make me give up.
Just to add to what, sorry.
I'm so sorry. Go ahead.
Just to add to just a little comment, just to add to what my fellow colleagues have said. What keeps me going is seeing the little impact I've made on somebody's life. Even the change in knowledge, and even a type 1 diabetes or diabetic accepting the fact that, because for you to begin a change, you need to accept the fact that you have diabetes. That can change you. So that alone keeps me going.
Thank you for sharing that. And I just want to acknowledge that Kuda has joined us, but I think we might still be having some issues with sound. Is that true?
How are you?
Oh, hello. Fabulous.
Well, I'm now here. Thank you. The network has been rusty, but I'm here now. I had to end up buying data because the Wi-Fi, I don't know what's been going on. It's been rusty over the past week.
Sorry. Thank you so much for joining and for making the extra effort. We can go ahead and click, if you'd like to take, we can just pause the Q&A for a moment. And if you want to go ahead and share, we'd love to hear from you.
Oh, is that okay? I thought maybe there was a problem. Oh, really? Oh, okay.
Yeah,
Well,
no, it's fine. We'd love to hear you. You all have such great things to share. We want to give you the space and time so we can, we'll kick back to the Q&A after, but we'd love to hear from you.
All right, thank you so much. Well, my name, it's pronounced as Kuda, and the surname is Chihata. That is it. I'm a Zimbabwean by birth, and I'm currently living in Botswana. I'm a member of the Insulin for All Harare group, or rather Zimbabwe chapter, led by Laura Monyoro. Yes, that is basically it for the introduction. If we could go to the next slide, okay. Yes, so as I was saying, I was born in Harare, Zimbabwe, but I'm currently living in Gaborone, Botswana. So I joined advocacy, it should be last year. I was introduced by a friend of mine, Tinotenda Zekiti. He is an advocate as well. And one of the things that made me join is the fact that I had a cousin who was a diabetic, and seeing them suffer from lack of medicine at times and lack of supplies, that alone was more than a reason that pushed me to join advocacy. And considering the fact that we at times had money, so here and could afford to really say, okay, let's put up money and take her to the hospital. Let's buy more diabetic supplies, considering how expensive it is. I just thought of other people who came from less privileged homes, and that alone was more than a reason for me to join advocacy. So out of advocacy, I'm a lawyer by profession. I'm an attorney. I'm currently registered in Botswana, in Zimbabwe, fully registered, and in Botswana, I'm waiting for my bar examination results. You know, with this law profession, whenever you move to a new jurisdiction, you have to write bar examinations, and they have to assess you, and the process is just hectic. I'm not yet married, unfortunately, but soon I will be. I basically love helping, and I have humanity at heart, and that is one of the main reasons why I joined advocacy. So the next slide. Yes, as you can see right there, that's a picture of me in 2010 when I was doing my grade 7 primary school. And the other picture, that was this year on the 4th of May, 2022, just after I had been admitted as an attorney in Zimbabwe, in the Zimbabwean courts. And yes, so what brought me to advocacy? That is a question which a number of people might want to, sorry. So what brought me to advocacy? That is something that a lot of people would want me to address. So first and foremost, I am an advocate because there's a challenge which needs to be addressed. There's an urgent and persistent challenge that needs to be addressed. Number two, the high prices of insulin and diabetes supplies, that on its own is more than a reason for us to advocate, considering the fact that there are quite a number of people who cannot afford. Many of us who are privileged to have phones, have laptops in Zimbabwe, but there are also quite a number. A very huge number of us are underprivileged, and they do not have access to insulin. They do not have the money to buy. It is costly, and as such, that alone, seeing that there is that need, made me join advocacy. And the third point is saying clearly this is a humanitarian issue because the prices are high and not all can afford. In Zimbabwe, it is very common to see people on the streets fainted. And many a times people will be saying, this person is diabetic, their sugar levels has just gone low. And yes, that is it. Many a time that is because the people would not be having the insulin. And the last point right there, I said I would like to honor a friend of mine from high school. That is Tinotenda Zekiti. That is the friend who introduced me to T1 International, who is a diabetic. And we used to see him inject himself with insulin, and we used to see him testing his glucose sugar levels at high school. So that on its own also pushed me to join when he asked me to join. And I would like to speak briefly. Can we please go to the next slide? So I would like to speak briefly on the price, or rather the costs associated with diabetes and insulin and supplies in Zimbabwe. So you will find that in public institutions, consultation fee might be from 10 to 20 US dollars. In the United States, that might be nothing, because at times people might be paid $10, $20 per hour. But in Zimbabwe, we might have people who earn $10 per month. And imagine, consultation fee is $10, and that is an amount that you need to work for the whole month for you to spend in one day. And if you're to go to a private institution, you might actually discover that they might charge from $100 to $120 for consultation. And then insulin, you get it from 6 to 15. Mind you, I said some people earn $10 a month. Some people can earn as high as $40 a month. And imagine, insulin is costing $15. That is basically half of their salary. And that is crazy. That is insane. As such, in Zimbabwe, we have been trying to push for the government to provide free diabetic insulin to all people. This is one thing that we have been pushing for in Zimbabwe. And the third point, let me just read it. This is not affordable for poor people or Africans. Yes, quite a number of Africans who are living with diabetes. And imagine, in Africa here, the employment rate is quite high. So imagine somebody who needs insulin and they are unemployed. How are they supposed to live? Basically, their life is at risk. Their life is being threatened daily and persistently. Hence, there's an urgent and persistent need for more advocacy in Zimbabwe, in Africa, and in the world at large. If we can go to the next slide. Yes, so basically in Zimbabwe, as a chapter, we have been trying the best that we can, but then at times, if you're to be in a country that is highly politicized, the moment you try advocating for free education, free health supplies, free diabetic supplies, free insulin, sometimes they take it from a political perspective and they might challenge you, but what you'd be trying to do is to save humanity. But as for now, the government has been forthcoming to some extent. This is a picture of a workshop that we had in Harare and in Zimbabwe. So in short, I might say we are currently on the right path in Zimbabwe, and I believe there is more that we are yet to do. Thank you so much. Allow me to thank Katie, Monique, and the team for organizing such a beautiful conference and for continuously supporting us right here in Zimbabwe. All stakeholders are highly appreciated. Thank you so much.
Thank you so much for sharing. So we are switching back now to the Q&A, and I think we have time for one or two. So we'll go ahead and if anybody, again, just to say again, if people have questions that they'd like to ask, you can raise your hand or you can pop them in the chat. And I'm just going to give a moment for that. All right, so I'm seeing a question: how has the pandemic, and particularly the rush to declare it over and end preventative measures, affected your work or the health of the T1 and T2 patients that you advocate for? So referring to the COVID-19 pandemic and just how that's affected advocacy where you are. If anybody wants to speak to that.
I would say that it has affected me with like meeting people, I would say. I've been trying to do just like the people that I know who need help that I have met, just wanting to, it's different when you get to lay eyes on a person, right? When you can really see how they're doing or, you know, what they need. So I would say in that aspect, it's affected, but we also have the internet too. So we have Zoom and stuff, but it's just that in-person connection. The pandemic has affected that, but in regards to the public masking, I think everybody's over the mask, honestly. And I work at the hospital, and it's like I have to transport patients. And so a lot of the patients that I transport are diabetics who are getting amputations. And so it's like when you got to put the mask on for them to transport, it's just like, oh my goodness. Still, I have to, I still have to wear this. And it's just like, yeah, we're all over it, but we just want you to be safe. So I think when it's how we think about it, honestly. When you change your thought process of it, like, okay, yeah, it's been going on for a while, but it's a safety measure. So we all want to be alive and we all want to be safe.
Thank you. And we have another question that came in from, and thank you for that question, Nathan. Joby has asked, when did you realize your voice matters? If anyone feels like they want to speak to that.
Well, I can try to answer for myself. I think when I became confident about my knowledge, because I usually doubt about what I know or what I don't, but I felt 100% confident that I had enough experience, diabetes experience, like day-to-day experience and knowledge, and I usually read a lot of articles and stuff on diabetes and try to be very careful about my health during the pandemic or even before. So I thought that it was really unfair that I didn't share my story, my experience, my knowledge for many years. And when I got that understanding, I realized that my voice would matter for sure, because I felt that confidence, and I felt that my experience, my personal experience, would help people when I give them advice or when I post something on the internet. So like that.
Kuda or Yap, would you like to share?
All right. Oh, okay. Yeah, the mic is still on. So I think not 2-3 years ago, but when I was in my high school, many a times we kept on hearing that choosing to be silent in times of oppression simply means that you have chosen the side of the oppressor. So that alone, when I heard that statement during my high school years, that is when I realized that I should take each and every opportunity that I have to advocate for anything that pertains and concerns to humanity, because if we don't, then humanity is definitely going to continue suffering. That is it. So the moment I heard of T1 International and the advocacy work that it does, that's automatically when I said I want to be part of this, because definitely there are people who are suffering, and there is need for us to raise our voices. There is power in unity, and there is power in voices that speak up together to the same thing. So yes, that is it.
Thank you so much. So we have reached our time. I just want to say the deepest thank you to all of our panelists for joining us this morning and for taking the time, or afternoon or evening, depending on where you are. And so I'm going to go ahead and close this out here. Thanks so much. We really appreciate all that you do, and it's incredibly inspiring to be a part of this community.